Hey everyone, I'm Joey. Today we're going to talk about a type of childhood brain tumor that a lot of parents worry about but don't really understand, posterior fossa ependymoma. If you have a young child at home, or you know a kid who needs brain follow-up scans, I'd recommend watching this all the way through. It can help you avoid a lot of common misconceptions. First, let me explain in the simplest, plainest terms what an ependymoma actually is. Ependymomas originate from the ependymal epithelial cells lining the inside of the brain and spinal cord. They're the third most common intracranial tumor in children, making up roughly 9% of all childhood brain tumors. They tend to show up most in kids aged 3 to 6, and the location is very concentrated. About 70% grow in the posterior fossa, in the area of the fourth ventricle. That location is both critical and dangerous. It sits right on the pathway that cerebrospinal fluid, CSF, has to flow through, so even a small amount of tumor growth can directly block CSF flow, causing hydrocephalus and raised intracranial pressure. What's even more concerning is that ependymomas can spread and metastasize along the CSF to the entire brain and spinal cord, so this is absolutely not something to take lightly. A lot of parents also wonder, why is the tumor often already quite large by the time it's discovered in a child? The reason is actually pretty simple. A child's brain has many natural cavities, so when the tumor is still small early on, it barely compresses any nerves and produces no uncomfortable symptoms at all. The child isn't in pain, isn't vomiting, seems totally normal, so parents have no way of spotting anything wrong. By the time obvious symptoms appear, the tumor has usually already grown to a certain size. This is exactly what makes childhood brain tumors so hard to catch early. Clinically, ependymomas are mainly divided into two big categories, supratentorial ependymomas and posterior fossa ependymomas. Today we're focusing on the one parents encounter most often and that carries the highest risk, posterior fossa ependymoma. The vast majority of kids get diagnosed because they develop recurring headaches and frequent vomiting. The underlying cause is that the tumor is pressing on the brainstem while also blocking the fourth ventricle, so the CSF can't drain out, intracranial pressure keeps climbing, and that's when the child starts showing all kinds of discomfort. When it comes to treatment, there's one core principle you absolutely need to remember. For posterior fossa ependymoma, the first-line treatment is always surgery. Because most kids already have a fairly large tumor by the time they're diagnosed, you have to remove the lesion as completely as possible through surgery. And since this tumor isn't very sensitive to radiation or chemotherapy, the quality of the surgical resection, how completely it's taken out, directly determines the child's prognosis and survival. Put simply, the cleaner the surgery, the lower the chance of recurrence, and the less pressure there is on follow-up treatment. Medically, these tumors are also graded by risk level. Grade 1 and Grade 2 are low-risk types with an overall good prognosis and a relatively low recurrence rate after surgery. Anaplastic ependymoma, on the other hand, is high risk, higher recurrence risk and faster progression. To treat it more precisely, the medical field also does molecular subtyping for high-risk patients, mainly dividing them into two subtypes, PFA and PFB. Of these, the PFA subtype is widely recognized as the hardest to treat and the one with the relatively worst prognosis, and it's a major focus of clinical research efforts. After surgery, let's talk about radiation. Posterior fossa ependymoma is moderately sensitive to radiation. It can't fully cure the disease, but it can very effectively suppress residual tumor cells and delay recurrence. So in standard clinical treatment, radiation almost always follows surgery. It's the standard adjuvant treatment process. If you've watched my earlier videos, you'll know that for childhood brain tumors, proton therapy has far fewer side effects than traditional photon radiation, and it does a better job of protecting the child's brain development. Finally, the thing everyone cares about most, chemotherapy. Let me lay out the differences between subtypes plainly. For low-risk types and the PFB subtype, the recurrence risk is on the lower side, and generally chemotherapy isn't needed. But for the hardest-to-treat PFA subtype, the chemo approach is still somewhat debated internationally, because the tumor varies so much from child to child and the sensitivity to drugs is completely different in each case, so right now there's no unified, standardized chemo protocol. This is exactly why doctors recommend that children with the PFA subtype get comprehensive genetic testing. Through genetic screening, you can pinpoint chromosomal mutations and poor prognosis targets, and then match chemotherapy drugs and targeted drugs accordingly, achieving precise, individualized treatment instead of treating blindly. Lastly, Let's take a look at the current state of ependymoma treatment in China. Over the past decade, China has made very rapid progress in research and clinical treatment of childhood ependymoma, and the overall cure rate keeps improving. In neurosurgery especially, top-tier hospitals led by Beijing Tiantan Hospital have reached world-class standards in complete resection surgery for childhood posterior fossa tumors. The surgical precision, experience, and success rates are all very reliable. On the radiation side, the number of proton centers in China keeps growing and the technology keeps maturing, and there's more and more experience with proton therapy for childhood tumors. You can check out my episode on proton therapy. As for chemotherapy drugs, China has long been in line with international first-line treatment protocols, and through national centralized procurement, drug prices have been brought down dramatically. While keeping treatment standards in sync with the rest of the world, the cost is far lower than in Europe, the US, Singapore, and similar countries. You could say the value for money is among the best in the world. So if a child in your family is unfortunately faced with this kind of disease, there's no need to panic. If you need to, you can come to China for treatment. China's current diagnostic and treatment technology, surgical standards, and radiation and chemotherapy capabilities can absolutely give a child the best possible chance at treatment. Alright, that's all for today. If you enjoy our channel, please click the subscribe button. Thank you everyone.